Good evening, everybody. I'm Dr. Pranab Bhattacharyya. I'm Associate Professor of Cardiology at Guwahati Medical College in Guwahati, Assam. So today I will talk on the prevention of heart attack. As we all know, heart attack is a very serious condition. It is, along with stroke, it is one of the major killers all over the world. So basically, since we should be, if we adopt to a healthy lifestyle and we try and control our risk factors and lead or continue with good habits. So there is a lot of scope in preventing a heart attack. So first of all, let us discuss what are the risk factors that might lead to a heart attack. So there are certain risk factors which carry very high risk for a person or a likelihood of getting a heart attack. So these risk factors commonly include risk factors. Initially, let me clear it up. They may be either modifiable or non-modifiable risk factors. That means the non-modifiable risk factors cannot really be modified, but the larger chunk or the major chunk of the risk factors are modifiable, and which is our primary target of therapy. So the first, the coming to the non-modifiable risk factors. So age is one of the non-modifiable risk factors. That means as you grow older, the chances of getting heart disease increases. Then gender may be a non-modifiable risk factor because in general, females or the ladies tend to have less chances of having a heart attack, but that is before menopause. Although after menopause, the chances of having a heart attack is almost similar to the male gender. Then the other non-modifiable risk factors may be a strong family history of heart disease in first degree relatives. So if somebody's father or mother had a heart attack or any first degree relative had a heart attack, his chances of having a similar disease increases. Then belonging to certain ethnic group, we as Indians, we are at very high risk of having premature coronary artery disease. That means we tend to develop blockages in our heart arteries at a very early age. So these are all non-modifiable risk factors. Now, coming to the modifiable risk factors, which is our primary target for prevention. So hypertension, as we know, raised blood pressure is a very important risk factor for development of cardiovascular disease or which may lead to a future heart attack. So uncontrolled hypertension is one of the risk factors. Then other risk factors include diabetes mellitus, then lipid abnormalities. That means if somebody has high cholesterol, high triglyceride, high LDL, or low levels of the good cholesterol HDL. So basically dyslipidemia. If somebody has dyslipidemia, his chances of having a heart attack increases to quite a certain extent. Then other risk factors include unhealthy lifestyle. That means being inactive or leading a sedentary lifestyle. Then others may include unhealthy diet practices. Then, so these are some of the modifiable risk factors which can be taken care of, which I will be discussing subsequently. Most importantly, smoking and use of tobacco products. This is, in fact, I want to stress upon it that this is one of the uh, most serious risk factors that is avoidable and preventable, which may lead or contribute a lot to the prevention of a heart attack. So uh, if we discuss the heart attacks one by one, hypertension, as we all know, is a raised blood pressure, which if it is untreated, have a lot of bad effects in different organs of the body, including the heart. So it may even lead to uncontrolled hypertension, may lead to stroke, then kidney damage, as we all know, and also it may affect the heart in various ways. And having a heart attack may be one of the manifestations that hypertension leads to coronary artery disease. Then presence of diabetes mellitus. So if somebody is a diabetic, then he needs to uh, undergo treatment and adopt healthy dietary plan and regular checkups for diabetes. And if somebody is dyslipidemic, that means if he has cholesterol disorders, say for example his total cholesterol is very high, or maybe his triglyceride is high, or the LDL is high, or the um, uh, levels of the good cholesterol, the HDL cholesterol, suppose it is low, and a combination or combination of lipid abnormalities, which may be atherogenic. That means it may promote deposition of cholesterol in the heart arteries, leading to blockages, and finally rupture of which might lead to a heart attack. Then smoking is definitely to be avoided. Then use of all tobacco products, including the chewing tobacco and the whatever commercially available products, it should be banned. And smoking is a lot of steps have been taken to prevent smoking in public areas, which is definitely contributing to a healthy environment, smoke-free environment where people can enjoy their walks or cycling. And so, a smoke-free environment, creating a smoke-free environment, is also of utmost importance in prevention of heart attack. Then, apart from these, we need to adopt a healthy uh, lifestyle. A healthy lifestyle would include regular physical activity, either in the form of aerobic exercises, walking, swimming, cycling, whatever it may be. At least 30 minutes of moderate intensity exercise daily is advisable, and it, as far as possible, should be adhered to so that we can take care of our heart and maintain a healthy heart lifestyle. And coming to the dietary aspect of prevention of heart attack, so diet plays an important role in day-to-day life. So we should, in our day-to-day cooking, especially the Indians, we do tend to use a lot of cooking oil medium. So we should use, as far as possible, the healthy oils, and then intake of fresh fruits and vegetables is very important, because fresh fruits and vegetables do provide a lot of beneficial nutrients that help in prevention of heart disease. Then intake of nuts like walnuts or other dried fruits, which are not paste, they do are definitely helpful. So a healthy lifestyle adoption is one of the key factors that might help in prevention of heart attack. And then I guess the important thing is, if somebody already has an episode of if somebody already has known heart disease, then importance of taking medications as advised by your physician or your cardiologist is very important. And amongst the important medicines, aspirin is one of the medicines which is, as we all know, is a blood thinner and helps in prevention of clot formation in the arteries and thereby prevention of heart attack. So aspirin, as advised by your doctor, in whatever required dose, considering your clinical background, you should continue with regularly. And apart from aspirin, another important medication is the statin medication. That is, a lot of people are being prescribed statins, identiform or atorvastatin or rosuvastatin. So these are also part of preventive strategies for prevention of heart attack. And regular medications for your hypertension or high blood pressure, then control of blood sugars, then, as I already mentioned, any form of lipid disorder or cholesterol abnormalities for which medicines prescribed. All medications should be, as prescribed by your physician, should be regularly adhered to. And non-adherence to medications may also lead to an acute event. So, medication also has a lot of role in prevention of heart attack. Another important aspect is it has been seen that in India, not only in India but the entire Southeast Asia, the premature coronary artery disease or blockages in the heart arteries do tend to occur at quite an early age. That means usually less than 35 to 40 years of age. There's a substantial amount of population who does suffer from heart disease, leading to myocardial infarction in the young or a heart attack in the young. So it has been seen that when compared with the older population, in these young population, the prevalence of smoking, then dyslipidemia or cholesterol abnormalities are quite frequent. And apart from obviously non-modifiable risk factor, which I had mentioned or discussed earlier, so it has been seen that the younger population do tend to have a strong family history of premature coronary artery disease in first degree relatives. And although hypertension and diabetes are more commonly encountered in the advanced age group, but in the younger age group, I feel still that prevention of cardiovascular disease, for prevention of cardiovascular disease, smoking cessation and use of tobacco product cessation still plays a very important role in future events, development of future events in young patients, in our young Indian patients. And so basically to sum up today's message, heart attack is a very serious condition. It may be disabling, especially in the if it occurs in younger age group, because the if it affects the earning member of a family, it does have economic implications also, along with chronic disability. So prevention is always better than cure, and as we all know that treatment costs are also involved. So if we can prevent heart disease by adopting healthy lifestyle, then trying to control our risk factors, taking our regular medications, and creating a heart healthy environment, pollution free environment. Because all these factors, even air pollution, vehicular pollution, everything contributes to the progression of heart disease leading to an heart attack. So, adoption of healthy lifestyle, healthy dietary habits, regular physical activity, and trying to create a healthy environment for not only ourselves but the entire society as a whole should be our aim. Thank you so much.
Yes, there are questions.